Joe Grogan and I worked together in DC for a while, and he used to be the director of the Domestic Policy Council at the White House, and now is a USC Schaeffer Center, I believe. But he's also in London, which explains the remote access to the conference, essentially. Joe, take it away.
Thanks, Casey and Tom. It's great to see you guys again, and I'm sorry I can't be there. This has been great for me to participate in. I'm so glad you're doing a conference like this. I hope this is the first of many, and I hope it really takes off, and more academic institutions that are focused on healthcare will have conferences like this, because they're to the point when Casey kicked off. It's too much of the debate is about who pays and how to get quote unquote coverage, and not how to get people care and treatments. So I've got a few slides here to talk about the AI policy landscape, because I think this is a real opportunity for young researchers, young scholars to really dig into, because it's, per Tom's conversation, it's we're at the beginning of this product development, and we're really at the beginning of a massive shift in regulatory policy as far as the federal government is concerned. Okay, so these are the working principles. This isn't a product of a huge ratification body, which is probably why they're pretty good. But this was a informal group of right of center healthcare policy thinkers that got together about 6 months ago. And to be honest, at the beginning of this flurry of AI media attention and regulatory attention from the Biden administration, and frankly from Europe, I live in London now and split my time between London and DC. And Rishi Sunak here and the European Union as well has been very focused on AI regulation. Tech issues can be very complicated, and I've got a lot of other complicated areas of healthcare that I'm focused on right now. So it wasn't something that I was champing at the bit to get involved in. And I kept on waiting for some leading right of center thinkers and private sector actors too, innovators, to step forward and try and push back on the dominant narrative that was being portrayed in the media, that AI was terribly scary and this was going to lead to a Terminator-like Armageddon, and only the federal government and a hyper-regulatory environment could save us from the dangers of AI. So a group of us got together and came up with some loose principles to guide our thinking, like, hey, is this what we can agree on as a starting point? And then we can work on how to address this. So at the beginning of the year, there was a lot of talk about, we're going to need a new global agency in the federal government to run AI for the entire federal government and be a master regulator. This is sort of a stupid idea, because there's all these different federal agencies, right? And AI applied in transportation, applied to the Department of Commerce, applied to the Department of Homeland Security or the Defense Department, is going to be different than applied to the Food and Drug Administration or the Centers for Medicare and Medicaid Services. So our first principle was we don't need a new regulatory agency. Interestingly, some people, some scholars and researchers we spoke with said, no, we don't want to commit to that yet. We may want that down the road. But for the most part, it was agreed that for the people that stayed in the group, we came up with this idea of a no new regulatory agency. And I think it's going to become clear in a bit why that's important. So that any regulatory framework should boost research and development and safeguard intellectual capital, not devalue intellectual property, not devalue research, not threaten eminent domain, and not threaten to take AI development products and development away from the private sector, or outlaw them before they're able to be developed. A key point, I think, that the woman mentioned just now about the barrier to entry, with doctors not wanting there to be certain expansions of practice of medicine, scope of medicine requirements for people, for say nurses, because it threatens their bottom line. This is a key fear of mine. Before I was a domestic policy advisor, I was what's called the Associate Director for Health at the Office of Management and Budget, and very focused on healthcare spending and how much the federal government spends on healthcare. When we're at, about $1.7 trillion, when the beginning of the Trump administration was about 1.2. There's been a huge explosion in healthcare spending, both by COVID, but also due to Biden administration and the Democratic Congress's expansion of healthcare spending. So we spend a lot on healthcare, and we don't want it to be cost additive. Typically, what happens with the new technology is doctors, for instance, if they're doing a surgery and they're getting reimbursed because they use a cost schedule at the Center for Medicare and say, okay, we're going to pay you X for a knee replacement surgery to a Medicare patient, and then a new technology comes on, and in the private sector, it should reduce costs. But what happens is the doctors will go in the lobby and they'll say, hey, wait a second, this can't affect our bottom line. Give us an additional payment, which is one of the reasons why healthcare innovation doesn't bring costs down frequently, as it does in other sectors. Education and healthcare are the two areas where innovation does not bring costs down, unlike everything else, unlike air conditioning and food production and televisions and automobiles. So we want to be disciplined about figuring out how AI can both reduce costs and improve efficiency. And government should abstain from dictating outcomes or limiting scientific debate. I mean, this is a key factor that in our opinion in my opinion, needs to be focused on. As we saw during COVID, there was far too much limiting of scientific debate among leading researchers in the private sector about how the virus was spreading. There was leading researchers were silenced, they were blackballed, they were pushed off of social media. Casey and I did a talk together about his book, and we were deplatformed off YouTube. And it was just nuts. I don't know what it was we said that offended people, but we were deplatformed at one point, and that was a minor incident, but there was like serious scientific debate that was being silenced. And it's already happening in the AI. There's so much conversation at the federal government about we can't have algorithms that lead to uncomfortable outcomes and results, and we need the government to make sure that the results are quote unquote approved. And it's sort of a scary moment, I think, in terms of scientific debate, because you can't have science without debate. You can't have advancement without debate and an open discussion. The regulations should not be overly complex, and we need to make sure that they are clear and that innovators know how to comply and what they're up against. And regulators should consider the impacts of regulation on innovation. Far too often, the federal government doesn't contemplate what a regulation is going to do to stifle innovation, to dry up capital. So if we could, let's see if I can go to the next one. There we go. This is great. So there's already currently a number of different ways that AI is being regulated. We've had machine learning in a number of different products for years, and FDA has been regulating machine learning products for many years. If you just look right there at number 3 with the FDA, um, they under their authority from the Center of Devices and Radiological Health regulate diagnostics and devices if they are to diagnose a disease, then they're technically under FDA authority. Now, frequently they don't always do that. Frequently they'll do enforcement discretion, or you'll see advertisements on TV that if it's not FDA approved, there's language that just skirts this line and says not intended to diagnose, but really, they're sold to for people to be able to choose them if they want, to help them inform their decisions. Your Apple Watch was a long-standing debate at FDA about how much regulatory authority they were going to exert over pulsometers and oximeters on the Apple Watch, and a number of these other things. And when I was at the FDA in the Bush administration, we were talking about regulating anything with an algorithm because we were worried about the black box. Now, ultimately, we refrained from that. We were not hyper regulatory, but there was a lot of debate, and there was a draft rule that went all the way to the White House and was discussed for months about whether or not it should be debated. And then a very restrictive rule was just issued by the Biden administration that encompasses these algorithm-based devices, but it's much broader than that too, to encompass all laboratory developed tests. And then, at the Federal Trade Commission, they have rules about honest claims about capability. So you can't lie and sell somebody something that says this device is fueled by artificial intelligence and it's going to tell you how to pick stocks perfectly. You're going to be a millionaire in 6 weeks if you buy this product. HIPAA, of course, is at HHS. That's data privacy for your health information data, and they have swept in a lot of AI-powered AI tools under their regulatory authorities. The 21st Century Cures Act requires different devices to be interoperable so you can move data back and forth. And then the Office of the National Coordinator, which is sort of interesting, this regulates health records. This was a big priority for the last decade, was to make everybody go to electronic health records. The Office of the National Coordinator sets the standards for electronic health records if you're in a federal program. That market is now dominated by just a couple providers, frankly, Cerner and Epic. Epic Systems is a privately held company. Cerner has subsequently been bought by Oracle. And all the big providers are on one of those two, and increasingly more with Epic. And that both of them use AI-powered tools in there to help inform doctors about what they should be looking for, whether it's, hey, this patient might be at risk for a heart attack, this patient might have an infection, things like that. There's a whole bunch of decision support tools. And this is a question for regulators, right? Is this diagnostic, or is this informing the physician and the nurse that they need to be aware, they need to be concerned and use their own judgment to look at this? Don't miss this. Make a conscious, rational decision to check for sepsis or to check and make sure that their sodium levels are appropriate. And the Office of National Coordinator is moving into this space pretty aggressively. They just issued a rule here. They'll be asking for more resources. That's what federal agencies do. They have a mission. They determine that mission is not ambitious enough. They move in to get to take over more regulatory space, and then they go to Congress and say, hey, listen, we have even more things to do, when nobody's asked them to do it. Congress did not tell them to issue this rule, but they'll be asking for more money, and they'll say, we can't administer the territory that we have just claimed without more federal resources. So there'll be a whole bunch of new demands on taxpayer dollars in the federal government if trends continue as the regulatory bodies want to regulate in this space. Interestingly, the Office of Personnel Management just issued a a rule that allows a massive bonus for AI engineers to be hired in the federal government. Off the top of my head, I can't remember whether it's 50% or 100% of salary, but that bonus could be at the top of the federal pay scale is around 225,000. So you add 50% on top of it or 100% on top of it to recruit AI engineers because they're so in demand. And there aren't enough going around in academia and companies, let alone the federal government. So they're really scrambling to hire more AI experts and engineers. And the big one is the Biden administration a few months ago issued an executive order on AI. It's 110 pages. The point person for this is the Deputy Chief of Staff for Policy at the White House. 110 pages is a massive executive order, by the way. It's the biggest one ever issued, and it's breathtaking in its ambition to regulate in this space. And it has unleashed a fury of rulemakings coming out of various agencies, working groups, meetings in this area. So the two competing visions for AI, I would suggest.
Joe, can you
Yep.
do you have a little bit more granularity on the executive order as it applies to healthcare? I mean, is it all healthcare or is it wide?
No,
yeah, exactly.
It's everything. Yeah, it addresses everything. There is a lot of focus on the need for regulation in the space, a lot of concern around equity, a lot of concern about the potential for bias, a lot of concern about the abuses that could result in the harms. Now, to their credit, they do talk about the opportunities that AI is going to present. They do talk about the fact that it's an important technology that needs to be advanced. But on this slide, just as I was about to say, when we developed the internet, there was a conscious decision on the part of regulators in the United States, policymakers, excuse me, in the United States, that we were not going to regulate it with a heavy hand. We were going to let it unfold, but in the marketplace, and the United States was going to dominate this area. And sure enough, that's exactly what happened. And a lot of credit goes, in my opinion, to Democrats and Republicans for allowing it to run the way it did. And it was an innovation. It was a remarkably libertarian ecosystem from the time it was really started to take off through the Clinton administration and beyond to recent times. However, a lot of people don't like what it became. And a lot of people think that it was the wrong approach and think that the government should have taken a harder line early on and required more regulation out front because it's led to bad outcomes. On the right, there's concern about what it's done for brain development, what it's done for certain things like the promulgation of pornographic content on young people and adults, the sale of illegal drugs in many parts of the internet. You can buy guns on the internet illegally. You can buy all sorts of stuff on the dark web. You can buy, there's human trafficking that takes place on the dark web. And there's all sorts of things that occur on the internet that if you're not using it the way people are using it in their day-to-day, it can lead you in some very dark corners, which concerns a number of different people. But on the left, there's concern about, hey, look, and I think they're quite open about it, too much speech. There's too much allowance for quote unquote disinformation, too much allowance for false content to be presented as real. And we made a real mistake in the United States by allowing the internet to run as long as it did without a heavy hand of regulation. And there is an emerging bipartisan consensus that's worth paying attention to for more regulation in this area, including regulatory changes to some of the insulation from the Section 230 protections that the internet companies get from lawsuits. So the debate right now is between that original libertarian salvation principle that defined the internet development versus the precautionary principle, which is where Tom and I really began to know each other when we both had a relationship with the HIV manufacturer, Gilead Sciences. In pharmaceuticals, FDA doesn't let you go out there and say, hey, we'll see if this drug works. And the marketplace decides. They make you go to the FDA, prove that it's safe or effective. They verify that it's safer. There's going to be trade-offs. There's going to be side effects, but they say on balance, it's more effective than its side effects. Every drug has side effects. It is on balance, provides value to society. It has positive health effects outweighing its risks. We're going to allow that to be marketed. And the precautionary principle is dominating now in the executive branch, the regulatory construct, the approach on AI regulation. For the most part, agencies are relying on existing authorities. The reason for this is the Congress is totally dysfunctional, and number one, and number two, there's no consensus anyway. So it would be really valuable to have Congress weigh in and work through a policy process about how we should regulate AI, but that's not going to happen anytime soon. And I've got news for you. Aggressive agencies can find legal authority to put a rule out there and claim regulatory authority over emerging technology. That's a big issue right now. The Supreme Court has a pending decision where they're evaluating whether or not how much deference the regulatory agencies get in the executive branch, absent explicit statutory designation of regulatory authority in specific areas. That's the issue is around Chevron deference. I don't want to get into it too much, but that's going to play out this year. That decision will come down before June or in June, before the Supreme Court breaks. And that's going to have a big effect on regulation writ large, including in healthcare, but in this area specifically. And there is a ton of stuff going on in the states, a ton of regulation going on with state regulation in AI. There's hundreds of bills that are being proposed, working their way through committee. That there's very active activity at the states, and there could be a patchwork of state laws that force the federal government to get involved in it, but that is not going to happen over the next 12 months, I don't believe. So a couple, facts here. They're not perfect, of course. You're building algorithms. You're going to have problems with things going wrong. And this is an early technology. Obviously, we recently saw the debacle when Google unleashed their Gemini AI tool, which was somewhat an embarrassing release for them as it gave crazy results. There was an incident in New York where a law firm was using artificial intelligence to help them with research, and they filed a submission to the court, and the AI tool had invented court cases. And the law firm had to apologize. They didn't review it closely enough. They put too much faith in the AI, and they got in trouble with the court for submitting a false filing. So you can have things go sideways on you with these if you're not careful. So I don't mean to say that this is not a fraught technology or that we can just trust that everything's going to be perfect. There are going to be growing pains. Now, a recent development that I find very fascinating and is worth your time to check this out is the Coalition for Health AI, or CHI. This is a new group that formed in the last few years, and they are set up opposite an outfit called the Health AI Partnership. Now, these two groups were set up to help figure out how AI should be regulated in healthcare. They were funded by a think tank out of California, from one of the early IT innovators in California, who made a gazillion dollars and set up a foundation. They were both set up on competing tracks. How do you think this should all unfold? And they have ended up in divergent paths. I would suggest to you that the Coalition for Health AI is playing the Washington, D.C. game brilliantly, while the Health AI partnership may be more sound on the policy and the reasoning and the science, but they've gotten outgunned on the DC game. CHI has in its coalition Google, Microsoft, MITRE. MITRE does a lot of consulting for the Department of Health and Human Services. And they have developed this assurance lab concept. And the concept is that, say, Tom, and one of his many lucrative investments in the private sector in artificial intelligence, wants to deploy an artificial intelligence diagnostic tool to improve patient care. He's going to send that with his company to a quote unquote assurance lab. Google is partnering with the Mayo Clinic, and they're going to take the data and they're going to take the algorithm and they're going to figure out whether or not it works. And they're going to give it its stamp of approval or disapproval. Now, Google is developing its own health artificial intelligence products, and so is Mayo. And I don't know another circumstance with such an obvious conflict of interest. Compounding this, the board is set up of federal regulators, including employees of the Food and Drug Administration and the Office of National Coordinator, which I mentioned earlier, which regulates health records. And the executive director is an employee of MITRE, the health contractor that does a lot of contracting with HHS repeatedly. So that's one model that they've adopted. Congress isn't paying too much attention and reporters haven't paid too much attention, which I find fascinating on this, because to me, it's like one of the great hustles in DC lobbying to be able to set this up with a board set up of private sector and public sector regulators. And the other thing that's fascinating to me is if you go through Google's history of trying to deploy healthcare products, it's like a murderer's row of disastrous defeats. Like they have never, ever, ever succeeded in healthcare. They continually get their ass kicked. They announce some big thing, they move in, it gets a lot of media attention. Then they have to wash out on it. They have never deployed a successful product. Mayo Clinic hasn't either. They have tried to commercialize products in the past, and ultimately they're a hospital, and they have failed too. Now they've figured out how to get involved in this, which is to turn themselves into the regulator. FDA has authority to grant third-party entities regulatory authority. At this point, they have not said they're going to do that with these assurance labs, but it's on the track to do it. They're trying to get more buy-in, and they're trying to get more momentum here before they're going to do it. But it's clearly on the track that the assurance labs want to be FDA validators for this technology. And then the Health AI partnership, their vision is, look, it is moronic to take your data and send it off into out of where it was gathered to a third-party validator that has no idea for what purpose it was gathered, doesn't understand the clinical context in which it was gathered, doesn't understand what it's going to be used for, and separate it from the patients whose health it is supposed to employ. So one of their examples would be, look, if you develop an artificial intelligence tool to improve patient care at the Veterans Hospital in San Diego, and you send it up to Minnesota to the Mayo Clinic and Google for them to validate it blind, they don't know why you were developing this, and they don't fully understand your patient population. So some of the members of the Coalition for Health AI have written on this in the past, the need for local validation. It needs to be validated in the field where it was gathered and developed and where it is going to be deployed to improve patient care. And the safeguard being, to go back to that example of the clinical support tool, it keys something to the physician and the nurse. It tells them be on the lookout for something, but the physician and the nurse is ultimately the clinical decision maker, and then you're validating it as you're providing patient care. That's their vision for it. And their interesting point, because the assurance lab concept gets wrapped up with a lot of equity arguments, is look, the surest way to defeat the goal of equity is to take it out of the clinical setting and move it into the abstract realm in an academic medical center. So it needs to, because you're dealing with a sick, diverse population in a local setting. If it's being developed in San Diego, but you're not dealing with a similar population hypothetically in Minnesota, where it's being validated, and you don't understand the ethnicities, you don't understand the racial bracket, you don't understand the cultural, the socioeconomic. You're validating something without any understanding of the clinical environment in which you are trying to say whether it works or not. And again, the conflict of interest, I think, is really quite stunning. This I referred to, I mentioned this before about this black box issue that if so when I was at FDA, I'll just give you this example because it's almost 15 years now that we were dealing with this. 15 years ago at FDA, you would have, when we were exploring regulating, the example was a breast cancer diagnosis. So somebody develops a laboratory developed test that purports to say the likelihood of the let's say the most persistent form of breast cancer, and that could inform, if you presented that to a patient, she might say, okay, I'm going to get a double mastectomy. But what's the reason for this? Like, what are the triggers to say this, to provide this clinical decision? And say, oh, well, the algorithm said it. We put the factors in, we took a blood sample, we took a history. She was diagnosed at 42. She's at stage 4, yada, yada, yada. But you don't know the variables. And at that point, the issue we were dealing with is people were developing laboratory developed tests, which were not regulating at FDA at the time. And they were bolting on these very sophisticated algorithms. And they were, in some cases, selling them across state lines and all this stuff. But it was a very sort of scary concept, as you can imagine, that there would be an algorithm that nobody understood what it was in it, how it worked, and patients might be making really drastic decisions about their health based upon that. So you needed some type of visibility into what is in the black box. And this science is mind-bogglingly complex. I'm in the process of working on a white paper at USC on this, and I've got an incredibly smart young researcher working with me, and like the variety of models being developed, the sophistication of them, how these things are operating. Every week there's some new hint of some new development somewhere. And of course, there's a lot of things going on in research areas that we have very little visibility into it. And then another issue that we need to think about is copyright of the data. Data isn't just data. If you're making sense of data, if you're scrubbing data, formulating it, putting it into an order, whether you're an accountant taking data, and then you become, say, E-Trade, and you're saying, well, yeah, I've got the data, but now I've scrubbed it, I figured out what the good data is, I put it into all these algorithms, I'm helping people pick stocks. Somewhere along the line, that data is copyrightable. Now, is it in the accountant's office, or is it when the accountant becomes E-Trade? And this is going to be a big issue. This is going to be a big issue as we move forward, because data is so valuable. I was recently at a conference where a very famous venture capital person was saying, data is in so much demand. There's talk in Silicon Valley about building robots to just go out and be aware and gather data. And it's one of the reasons why Tesla is valued the way it is and why it has so much enthusiasm. I know the stock has taken a hit over the past year or so, but it has a tremendous amount of value in there because of the data it's gathered from people driving about how they react in situations, but about roads, about geography, about all sorts, how other people react. And all that data feeds into their artificial intelligence product development and can be sold for other products too. But it could go anywhere. I mean, they could develop anything with that data. And just to flag, the Copyright Office is going to be issuing a report to look at the copyright law issue related to AI and data. I think it's supposed to be the end of this year, but it could slip. But I think they're going to want to get it done before December. That's their target, because they'd want to get it done either before the end of Biden's term, or if he were to lose the election, they would definitely want to get this report out before, so they'll move forward. And I seem to have lost my ability to, one thing to think about here is the reimbursement for AI, as was alluded to in the question right before I started talking about. The other thing to think about this is how much waste can be saved. I mean, it is astounding how much waste is done with tests that didn't need to be done, services that didn't need to be created. So you can really reduce, the potential is there. The potential is there to really reduce spending in healthcare from a federal government perspective, including flagging for fraud. 360 billion is probably an understatement, but when you layer it into the private sector as well, not just fraud and reducing paperwork, for instance. I don't know if anybody's experienced going to the emergency room lately or being in intensive care, but the physician comes in or the nurse comes in with an iPad, doesn't look you in the face or your friend in the face or loved one in the face, but is looking at the iPad when they ask all these questions, entering data, and then leaves. Well, if a physician or a nurse could come in, and they're doing this now, but as a matter of course, you had it all voice activated, and the AI could incorporate that data, they could make a connection with the patient, really understand what they're going through, their symptoms, because there's too much depersonalization going on right now. It makes patients very uncomfortable. They're frequently not truthful in their answers, and they're not as forthcoming as they could be. This is a example of just some of the AI fueled tests. Sorry, my dog is barking in the background. Just some of the AI fueled tests that have been developed lately. And you see that APC stands for the ambulatory payment classification. That's a Medicare term that they use for reimbursement. So they're granting these additional payments for the technology. I'd like to see them figure out a way to reduce the overall payment and get cost compression here and not increased payment. I mean, Tom was great, so I'm not going to beat this up too much on its applications and how it's going to revolutionize things. But he mentioned all the opportunities in drugs and devices, and I mentioned health records as well. Just to get back to this program integrity issue, there's so many improper payments that go out of the Medicare agency. I mean, it's just insane. And the same thing with Medicaid. You see these headlines, if you pay attention, to massive amounts of improper Medicare and Medicaid spending, or Justice Department swoops in to some organized crime syndicate that had figured out how to bilk Medicare. And you're talking tens of billions of dollars in some instances. AI could really help clamp down on that. and synthetic biology, which is a really fascinating field where we're figuring out how to use the tools of engineering in the biological context to build things um, uh, through human reason. But AI could really help increase this as well. Things which would have tremendous environmental positive impacts too, if you're able to engineer organisms that then grow what you need, whether it's leather for automobile seats, but then they'll decompose at some point, or replace plastic bottles with a compound that is biodegradable over time. And let's see, I'm thinking we're almost done. I'm not going to beat this up too much because Tom talked about the drug developments, but AI is going to be fueling more at-home care. This is a trend because people want to be in their homes and hospitals are too expensive. But making a human being available to provide advice and intervene and say, oh, we need to send an ambulance. This person is in trouble in their home. They need to get to the hospital now. They're having an acute event. AI can really help do this. The UK data, it's interesting, but I think we're so new to this right now that it shouldn't really be extrapolated to say that AI can't help, because this is such nascent technology in this space. There are a lot of risks, as I alluded to it. You can have different types of errors, including, for instance, if you try and sail from London to Savannah or Miami, you're off by just a little bit at the beginning. By the time you think you're in Savannah, and you're actually up in the Arctic, because your starting point was just a little bit off kilter. You can really get the wrong results with bias amplification if your data set is not big enough. And that has been a counter argument on a lot of developers to this concern around algorithmic bias, which is to say the solution to getting biased results is just a bigger data set. Of course, if your data is all white males or white women who from upper socioeconomic group, you're going to get different healthcare results than if you were going for a more diverse group. So you need to include, depending on what you're looking at, if you're looking at white women in that instance, and you develop an algorithm for their treatment, fine. But you can't extrapolate that. And it needs to be labeled and understood. Where did this data come from, and what was its makeup, and understand for the purpose in which the AI product is being developed. The same is true if you want something that's broadly applicable. You're going to need a broadly applicable pool, and you're going to need a very diverse pool. You cannot get these model hallucinations, like I mentioned with the legal filings, where the AI tool invented cases that didn't exist, that were clearly convincing, until one of the paralegals at the court started to look into them and realized that the cases didn't exist. And model collapse. I don't want to spend too much time on how all these things can go wrong, but if you're not validating your model with sort of, I'm trying to think of a good analogy here, but like a pace horse, or an outside a shotgun model, where you're validating it with other results in your algorithm and taking your data set and putting it into a different algorithm, then if you don't have a way to an external validator, then you can have this situation where the model collapses over time because it's validating itself. And of course, but doctorate and fraudulent research is always a problem in any type of research or product development, whether it involves AI or not. The defense to this is just not to give the AI product more deference, in my opinion, than any other science that you're not fully aware of. So, doctors frequently prescribe medicines. They understand the basic chemistry. They understand the disease progression. But there's a lot of things about that drug that they don't understand. And frankly, there's a lot about why drugs are effective in certain instances that even the developers don't understand. But the drugs are given, and then if there's a side effect that's not listed on the bottle, human reason intervenes. The patient, the doctor say, hey, wait a second, this thing is making me break out in hives. And it wasn't seen it's not on the label. There's nothing in the clinical research, but this patient is having a side effect. Let's take him or her off the drug. And then maybe there's a confounding factor and they go back on the drug after a few weeks and see if there's enough, the side effects persist. But the point I'm trying to make here is that you can't just turn off human reason with these things. You can't just say, oh, well, the algorithm told me this, the black box told me this. We are still in a development stage. And this tool of Tessa was a program for weight loss advice, and it was giving the absolutely opposite advice to people about what they should be doing to address their eating disorder. I mean, it was bizarrely inaccurate.
Eat more and exercise less.
Yeah, I mean, it was even for people that were like anorexic and bulimics. It was giving or obese. It was just giving terrible advice, like what you would not do. Like, and of course, some of these people are in pain as they're trying to figure out what to do with their diagnosis. Now, I don't think this thing is exhibited to actually have caused human harm because the results were once deployed, they were so obviously crazy. I don't know of any instances of people actually following it, but somebody developed it, thought it would work, and it didn't. But the results were transparent, right? And people were able to say, okay, it's suggesting this, and this doesn't make any sense with our clinical experience and with common sense. I mean, loss of clinical expertise as providers increasingly defer to AI. This is a concern of mine. Frankly, I used to be awesome reading maps, and I drove across the country all sorts of times before the advent of Waze and Google Maps. And I can't drive down the street anymore without Google Maps. I mean, I can't drive 10 minutes without slapping that thing on to help me get from point A to point B. And not many people can anymore, frankly. So the danger is people will get a lot reliant on AI, and then we will lose clinical expertise and the judgment that comes from doctors and nurses, the judgment that comes through practice over time. And of course, this is always a problem with data. There's going to be hacking. This stuff isn't secure right now. There's a lot of talk about making people put it all in the cloud. Interestingly, this is one of the things that Oracle's doing in their Cerner acquisition. Oracle stock has been on a tear because they've really bet on the cloud. And one of their reasons for this is to enhance data security, that it's not going to sit on somebody's hard drive. It's going to be securely locked away in the cloud.
So, Joe, are these risks the ones the executive order goes over, or is this your risks because they're concerned with other risks than these, right?
Yeah, I think you would say these are objective risks.
But they're not the risks that are the concern of the new 100-page executive order.
Right. I would say they're adopting the precautionary principle, and they're worried about a lot of things that have yet to be borne out. Now, the rhetoric, to be fair, the rhetoric in the media with you turn into Fox News or CNN and they've got Arnold Schwarzenegger from the Terminator and stuff. I'm not going to say that's what the Biden administration is doing, but there is so much concern about the risks and focus on the risk in that executive order, and in Europe, including in England, saying, no, we can't allow this to be, AI is going to hack into all our banks. It's going to be able to launch nuclear weapons when we aren't paying attention to it. It's going to shut down people's medical devices when the AI program decides that their life isn't worth it anymore. All these things, these parade of horribles that are being discussed. And of course, racial bias is a big thing in equity. There's a lot of concern around, is this going to lead to enhancing discrimination? And some of that is justified. I mean, big organizations historically have used sophisticated tools to discriminate at various points. And the question is here, are we going to guard against that? Are we going to be aware of it? Are we going to try and address it? Or are we going to say, we're going to trust the regulators to do it? And I'm not all that fired up to trust the regulators, because regulators frequently have people who are not culturally aware or maybe biased themselves. And I think this is a common problem for all of society to address. And if we do it transparently and have open discussions about it and make sure our data sets are big enough, I think we can address it.
Were they mainly concerned with equity issues in the executive order, or are there national security issues, or like what are, I mean, and how
national
how do you
security
separate that
issues
from
are
health?
addressed.
What?
Yeah, national security are addressed. Equity is a big part of it, that it's only going to be available to the rich. It's going to enhance the gap between rich and poor. It's going to lead to tremendous displacement in the workforce. And a lot of the unions are concerned about this. And Joe Biden has made it clear we're not going to fire anybody in the federal government because of AI. It's going to be enhancement. One question would be, though, why should we adopt that? I mean, maybe we don't need as many people working for the federal government. The federal government does a lot of people working at the FDA perhaps could review things more quickly than if they had a decent AI tool to spot certain issues and evaluate data themselves. They could get through more applications, but maybe they also wouldn't need quite as many employees at the agency. That's just one example that I know you care about.
Joe, there's a question from the virtual audience. David, would you like to speak up? Can you unmute yourself?
Yes, thank you very much. Joe, you mentioned earlier in your presentation about Epic and Cerner in the electronic medical record space. And I wanted to just say that Epic is really dominant in this space, particularly because they're in the larger hospitals and they're in virtually all the hospitals that train physicians. So that nearly all the physicians now are being trained on Epic. So Epic is going to become more and more powerful, more dominant in the industry. When it comes to this AI technology, they serve as gatekeepers. Nobody's going to get into a hospital with new AI technology without going through Epic. And my concern is their interest, they have a business interest in giving preference to technologies where they're going to get a bigger cut of the revenue, number one. And number two, they're going to serve the economic interests of their clients, the hospitals and doctors. And right now they're focusing on getting in these nice technologies that are going to assist doctors in doing notes and a whole bunch of things. But when it comes down to technology that's going to start affecting income of the doctors or the hospitals, their incentive is to protect their clients' economic interests. So here's a private company. What are you going to do to get their incentives aligned with the interests of patients?
It's a great question. It's a big, it's a big discussion. I mean, who owns the data and who can get access to it? Does the hospital own the data, and are they going to be able to partner with innovators to use that data to develop products? Epic's dominance, it didn't happen overnight, which is the interesting thing. I mean, they were the small player for a long time, and they've, blown everybody out of the market, not through acquisition, interestingly enough, but just driving people out of the market and more hospitals choosing them. There is talk about cracking the hospital data open, including Epic's data, but I think it's a question. I mean, Epic develops the system. They rationalize it, they make it useful. Data isn't just data, and say, oh, well, you made sense of the data, I want it now. The other thing to consider is, from my perspective in this whole context is, the federal government should put its data out. The federal government has, if you want to put data open source and convert data into open source, have all the CMS data out there. Have all the NIH funded research data out there for everybody to see. And yet the federal government husbands a bunch of this data. And we need, if before we go into the private sector and say, look at all the work you did to rationalize this data and make it theoretically marketable or turned into a product. We should be doing that with all the federal government data. Instead, they're making it harder. And they're making it harder to get at CMS data, which has been kind of controversial over the last year. They're charging more, and they're gatekeepers. Not anybody can get it. You have to prove to CMS that you have a quote unquote worthy purpose and that you're the right type of researcher to get access to their data. CDC has a ton of data. I mean, I would argue, frankly, CDC needs to get out of the business of publishing their research. No CDC employee should be able to put their name on any research because they fund this research and then they sit on it for 2 years until the CDC employee gets to punch it out. And that should be public information right away. It should be turned around very quickly and pushed out and help product developers use it if there's a value in it. So Dave, I think those are all great questions, and the where all this data is, which is why, I mentioned the Tesla example, but data is like water. It's so important. It's like, or oil. It's so valuable. And it is the big question probably in all of this is who owns the data? When do you require it to flow? When do you push it out there for common development?
Joe, we're speaking from Chicago, and guess what? In Chicago, the criminals don't obey the rules. Just as chumps, who are law-abiding.
I think that's the nature of what a criminal is, regardless of
Yes,
whether they
but
don't obey the rules.
I think that needs to go into one of your warnings about regulating AI, because who's going to have to follow the regulations? Us law-abiding people, but the fraudsters aren't going to follow the AI rules. They're going to be, unconstrained. And so we'll lose the race even to criminals if we're constraining, the law-abiding sector.
I think
Because you were optimistic about the fraud, like, oh, we're going to use this to beat fraud. No, the fraudsters are going to use it to beat us.
It's fair. No, I think it's true. And there are these scary examples of AI products that can take my voice. Like if somebody's on this phone recording it and knew what they were doing, they could call my bank when this conversation is over, and try and get my accounts and things like that. I mean, that stuff can be done. I do think we need to be worried about national competitiveness though, too, and national security writ large, because there is a ton of money in the Middle East flowing into this space for research and development. There is a ton of money in China flowing into this. And the example I would use is we have a competitive advantage when we rely on innovators and competitive spirits in the free market. We are not the best regulators in the world. Other countries are better at regulation than we are. We don't have that tradition. It's not in our blood. But when we're wide open, we win. And we can win this race, but not if we adopt the precautionary principle and say that every AI product is going to can only proceed without the express blessing and approval of the federal government. We need to encourage people to develop in this space.